Hi there, Casey Shepard, health coach here, bringing you more education and information on your health, hormones, and internal system so that you can make better educated decisions for yourself and dive into figuring out some of your own issues. It took me years and years and years to figure out a lot of the things that I know today with not a lot of information out there. So I just think it's so important to educate, give back to other people so that other people can dive into their own issues and figure out a lot of their own health things that are going on. So today I want to talk about the thyroid and specifically Hashimoto's versus hypothyroid. Now, first of all, they are two separate issues, but they can be one and the same. And if you have hypothyroid, you may be diagnosed by your doctor, but you could also be having something called suboptimal hypothyroid. If you are diagnosed hypothyroid, it is something that is an extremely easy diagnosis. It's very apparent in the lab work. Your TSH is through the roof, and you may have some just very low thyroid levels. If you have suboptimal hypothyroid, it may be undiagnosable. Now, you can start experiencing symptoms far before an actual diagnosis. Now, there's a few problems. When a typical doctor runs thyroid levels, they're usually only running a TSH and maybe a T4. Very rarely do they run a full thyroid panel, and you really need to have a full panel to determine any imbalances and suboptimal thyroid issues, but especially for Hashimoto's as well. So the first issue is that they're not running enough lab work to determine if there's some sort of thyroid issue going on. But secondly, if it's considered suboptimal, then you may still be in range, but sort of have lower levels. Your TSH could be, a little bit higher than we would like to see it. So your T4 and T3 levels could be maybe a little bit on the lower end, but not quite too low. So a doctor will just say, oh, let's keep an eye on it. But it does not mean that your thyroid is functioning at the level that it should be or needs to be for your specific system. Personally, for me, I have had both, where when I was in part of my healing journey, I did have a clinical diagnosis of hypothyroid where the TSH was a little bit higher. But then as later years went on, maybe it got a little better, but I was still consider myself suboptimal thyroid, where I just wasn't functioning at the level in which I know I could feel good. So when you do more integrative therapy and holistic healing, when you look at the thyroid levels, we really do base a lot of our diagnoses on symptoms, not just the lab work. So we got to look at the entire lab panel as well as the symptoms you're experiencing, your health history, some of the other symptoms that you have. And so that is really how we look at thyroid. And there's a lot of different ways to treat thyroid, different medication protocols, but really it's a mineral issue, it's a deficiency issue, it's a gut balance issue, it could be a stomach acid issue. And each person, we address the hypothyroid or thyroid imbalance differently depending on the situation. And I don't really just like to look at a thyroid panel alone. I like to look at all of the hormones because other hormones can impact the thyroid and vice versa. So it's important when we're going to say, hey, this is how we're going to treat it, that we look at what are the other levels that are off and what else could be contributing to this. And that gives us a game plan for how we address it. Is it mineral nutrient deficiencies? Is it a stomach acid issue? Do we have a lot of estrogen dominance? Is there a deficiency in progesterone? What are your stress levels like? And when normal people will look at lab work, they'll sometimes try to throw everything at you at once, but especially in a woman's body, but even in a man's body, everything is a feedback loop. So instead of throwing everything at your system at once that it's lacking, you have to know what is a downstream effect and what will doing this one thing trickle down into, and how will that affect everything else. And so we don't have to do everything at once. We do a couple of the things that will impact it the most that will then carry over into fixing that issue. So, and if there are other imbalances going on at the same time, of a hypothyroid issue. A lot of times for women, it's heavy periods, estrogen dominance issues, issues detoxing estrogen from the liver, which can lead to estrogen dominance symptoms, progesterone deficiencies. So it's you can't just bring someone to a doctor and put them on a medication and think that they're just going to start feeling better, because it's really not how it's going to go. Addressing some of those root issues and deficiencies is really how you bring that thyroid healing to the next level. And moving along to the hypothyroid or the Hashimoto's is really Hashimoto's is not a thyroid issue. It is an autoimmune condition. And sometimes it starts as a hypothyroid and transitions into Hashimoto's, but sometimes you can have your thyroid's fine, but you, for whatever reason, have this autoimmune condition that's attacking your thyroid. And then it becomes an immune system issue that needs to be dealt with separately. A lot of times I see them both together, where it is suboptimal thyroid as well as Hashimoto's. Majority, or I wouldn't say majority, but there are a lot of people who have hypothyroid who then kind of becomes an autoimmune condition. And then you've got even more to deal with from an inflammatory response and an immune system response. So monitoring the stress levels, what sort of nutrients are we getting in? Is there an iodine deficiency? Are there other mineral deficiencies going on to heal this? What is the stress like in your life? How can we manage this more? What is your nutrition intake? How are your blood sugar levels balancing? Is your liver functioning correctly so that you can actually produce the thyroid hormone that's needed and convert that T4 to T3 so that you're getting what you need in your system? So all these things need to be looked at, but there is a lot of confusion surrounding thyroid conditions, thyroid hormones. And it's something I work with a lot. It's very common, especially in the Midwest. They call it the goiter belt because of the lack of minerals that we have there. So it is common. It's something I work with a lot, but even just with other imbalances and stress on our systems these days, it's just become one of those very common things. But a lot of people get on medication. They're still having hair breakage. They're still having brittle nails. They're having skin issues, breakouts. They have the brain fog still, digestive issues, even after medication, even after the lab work is showing that they're in a better place. So it's because they're missing out on a lot of these other things, the nutrient deficiencies and stuff. Medication will never fix that for you. So it's my suggestion that you always go more of the natural route first, or you work with someone doing integrative medicine where you say, hey, like medication might be necessary, but we also need to be doing all of these other things in conjunction with that to truly make you feel better and to be working. And a lot of times I end up getting people to really cut their dose down, come off of medications completely, or just work with that medication to get them to have, feeling better on the stuff that they're on, or just switching, suggesting other medications to take instead of the one that their doctor would suggest. And it's just a better fit for them. So like always, I work with people all around the US. If you're somebody suffering from any of these things, or you think you might, I do lab work everywhere. I can help you from anywhere. So please reach out to me in my description below, my website, or by contacting me through my social media channels.